So we are ready? Okay, thank you. Good afternoon, everyone. I'm Mike Farnworth, BC's Solicitor General, Minister of Public Safety, and I'm honoured to be here on the traditional territory of the Lekwungen-speaking people and the Songhees and the Esquimalt nations. I'm joined today by my colleague, Adrian Dix, BC's Minister of Health. The impacts of last year's heat dome was devastating for our province and for those who lost loved ones. After last year's event, it was clear we needed to take a hard look at our response to extreme heat events and to take steps to ensure we've prepared for more of these events in the future. Today, we are announcing a new heat preparedness plan to make sure we're ready for the next heat event. As part of this plan, the Ministry of Health has developed the BC Heat Alert Response System, or BC HARS, so people across BC are warned in advance of heat events. In the case of a heat event, the province and local authorities will take appropriate actions based on their individual heat plans and processes. We will also widely share information on how people can prepare and protect themselves. The BC HARS will issue 2 levels of signals: heat warnings and extreme heat emergencies. For extreme heat emergencies, like last year's heat dome, we will be prepared to issue a broadcast intrusive alert through the National Alert Rating System. This builds on our expanded use of Alert Ready to issue alerts for wildfires and floods, in addition to amber alerts and tsunami warnings. We've also recently announced a new stream under the $189 million Community Emergency Preparedness Fund to provide funding to communities for heat risk, mapping, assessment, and planning. This funding stream is open for First Nations and local governments with a deadline of June 24th. It's intended to support communities to ensure they have accurate knowledge of the risks associated with extreme heat and how these risks will change over time, and to develop effective response plans and strategies to prepare, mitigate, and adapt to those risks. And we continue to work with First Nations and local communities and make supports available to them, including providing clear guidance on eligible expenses, such as opening cooling centres and transportation to cooling centres. To help people prepare, the province has also created a new Extreme Heat Preparedness Guide, which has guidance to help people prepare themselves, their families, and homes for extreme heat. It also includes advice on how to cope and stay safe when temperatures rise. This guide is available in multiple languages and was created in partnership with the BC Centre for Disease Control. A great way to get ready before a heat event is to make a plan and to get prepared. As part of the plan, identify cool zones inside and outside of your home, such as community centres, libraries, or malls. Identify neighbours and family members who may be at risk during a heat event. If heat has a severe impact on you, or you live in a building that gets very hot, plan to go elsewhere during a heat event. If you live alone and need extra help, pick someone to check on you when temperatures rise. They could take you to cooling centres or help with cooling measures in your residence. There are also modifications that you can make to your home that can make a significant difference. For example, digital thermometers to accurately measure indoor temperatures. 31 degrees or higher is dangerous for vulnerable people. When a heat event is happening, there are many actions we can take to keep ourselves and family, friends, and neighbors safe. Stay in cool zones inside and outside of your home. Take cool baths or showers, drinking plenty of water, and checking with neighbors who may be at risk. Watch closely for signs of heat illness in yourself and others, including dizziness or fainting, nausea or vomiting, confusion, headache, rapid breathing and heartbeat, and extreme thirst. If someone experiences any of these symptoms during extreme heat, immediately move to a cool place, start cooling down, and seek medical attention. Follow directions from your First Nation or local government who may open cooling centres. For more information about how to prepare for heat emergencies, visit preparedbc.ca/extreme heat. You can also find other resources on how to prepare for other emergencies, such as flooding and wildfires, at the Prepared BC website. I also want to take this opportunity to encourage everyone to take steps to prepare for spring floods to protect your families and property. Check your flooding insurance coverage. While residential flood insurance can be limited in higher risk areas, insurance representatives can help determine if residential flood insurance or SUIP backup coverage is available for your property. Create grab and go bags for each member of your household with the essentials you'll need if you're asked to evacuate. Protect your home by moving equipment and other objects to higher ground where possible. Make sure to clear perimeter drains, eaves, troughs, and gutters. If you think you need sandbags to protect your home, you can contact your local government for more information. And listen to local officials if you are asked to evacuate. Our province continues to experience the impacts of climate change, and we need to be ready for all kinds of emergencies. Take the time to get you and your family ready for heat. I want to thank you, and now I'll turn it over to Minister Dix.
Thank you, Minister Farnworth. I too am honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. As Minister Farnworth said, last year's unprecedented heat dome had a profound effect on many British Columbians, on many communities, and showed us we need to do more to ensure that we're better prepared for future extreme heat events. I want to again express my condolences to everyone who was affected, everyone who lost loved ones due to last year's heat dome and extreme heat events. I also want to assure British Columbians that we've been working tirelessly since last summer to ensure that people and communities are better prepared and protected in the event of extreme heat events. To say the least, this is a top priority for us. That's why we've developed the BC Heat Alert and Response System, and why we've made major investments to boost the ambulance service. These measures will ensure that people get warning of extreme heat events, and that when they call 911 and need an ambulance, they will get one. The BC Heat Alert and Response System will give people and communities the time and information they need to prepare and protect themselves. The new alerts will give people the signs of heat stroke and remind them to check on neighbors, friends, and family members. Another key aspect of BC HARS is that it alerts decision makers to take preventative actions to protect public health. An example would be that groups that work with seniors may do wellness checks, provide air conditioning units, and ensure access to cooling centres. I'd like to recognize everyone that worked with us to create BC HARS. That includes BC's health authorities, BC's Emergency Health Services, the BC Centre for Disease Control, the Office of the Provincial Health Officer, Environment and Climate Change Canada, Emergency Management BC, BC Housing, WorkSafe BC, and others. This groundbreaking work happened against the backdrop, of course, of two public health emergencies, the COVID-19 pandemic and the overdose public health emergencies. In order to have BC HARS ready for the summer, developmental timelines were condensed. As a result, we will continue to engage and consult with communities and stakeholders to ensure the system meets their needs. We've also taken several measures to improve the ambulance system and emergency care across the province, some of which I announced last July. BC Emergency Health Service has created a new clinical safety plan that will guide them in responding to extreme heat events. This plan includes several measures to ensure our ambulance system is ready to respond to a significant increase in 911 calls during a heat emergency. For instance, staff may be reassigned to support areas experiencing higher call volumes, and we may take measures to reduce turnaround times at hospital. We have also added in this period 125 new full-time paramedic positions in urban areas, 42 new dispatcher positions, and 22 new ambulances. Additionally, we've converted 24 ambulance stations from on-call paramedic staffing to 24/7 stations, improving service in many rural communities. And since 2017, we have significantly increased our spending on BC Emergency Health Services from $424 million in 2017 to $559 million in 2021, about a 2021-22, about a 32% increase. All of these initiatives, BC HARS, improvements to BC Emergency Health Service, to the ambulance system, and the measures Minister Farnworth has described are just part of our wider efforts to prepare and protect people in the event of extreme weather events. Our government obviously has done the work on the climate preparedness and adaptation strategy that strengthens our ability to stay safe and respond effectively to a changing climate. We know that we will continue to see an increase in the severity and frequency of extreme weather events due to climate change, and we must and we will be ready to respond. I encourage everyone to start making plans now for how you will protect yourself and your loved ones, particularly those that are vulnerable. Together, we can prevent heat-related illnesses and deaths. We need to do it as a community and as a province and as individuals, and we need to do it together. Thank you very much.
A reminder to media on the line, please press *1 to enter the queue. You will be limited to one question and one follow-up. We do have some media here in the room, so we're going to start with Keith Baldry, Global News.
A question for Minister Dix. Minister Dix, the Centre for Disease Control just issued a statement saying BC now has its first confirmed case of monkeypox. Just wondering if you could put that in context. What does it mean? What are the concerns?
That's right, and the team at the BC CDC, including Dr. Mayak Singhal, will be available to talk to media about some of the health details. He's an epidemiologist for communicable diseases at the BC CDC, and Dr. Mark Lysician, who's the Deputy Provincial Health Officer, or should I say the Deputy Chief Medical Health Officer in Vancouver Coastal Health, will also be available, so they'll be available. We do have, as they've said and as they've confirmed at the BC CDC, one confirmed case. What this means is that this is someone who's been confirmed through laboratory testing at the BC CDC. You recall at the beginning of the COVID-19 pandemic, we further confirmed such cases through the National Centre until we're essentially accredited for that. That's the final confirmation. Nonetheless, we're confident that this case is in place, that this person is lives in the Vancouver Coastal Health area. The risk of monkeypox to the public is very low, nonetheless. And as people will know, there have been several hundred cases in non-endemic countries, meaning countries that are not in endemic areas of monkeypox in Africa, monkeypox having been around for decades, as members of the media will be aware. As of last Thursday, I believe there were 56 cases in Canada, 54 of them in the province of Quebec. So there will be more information about the details involving this. Suffice it to say, the risk to the overall public is low, but we want to make sure that everyone is aware and knows about this issue and is aware of all the steps being taken to support this individual's close contacts, and the community.
And second question, different topic, but still with Minister Dix. This weekend saw some more shortening of hours in some emergency wards. We've seen this from time to time. A doctor in Kelowna says he's never seen a staff shortage like this in terms of doctors and nurses. I wonder if you just, again, I know you've talked about this before, but what's going on out there in terms of this, what appears to be these chronic shortages of healthcare professionals?
Well, we're seeing it. I was on a call with health ministers from across Canada today, and we're seeing it in other provinces. I think the temporary closure, I believe, of 9 emergency rooms in Newfoundland, similar numbers in other provinces. So this is something that is a national issue with respect to health, human resources. I think a number of things are happening at the same time. One, we've gone and added net 32,000 new healthcare workers to our healthcare system in 2 years, which is an extraordinary achievement, I think, of our healthcare system. And you've seen some of the examples of that in measures that we've stepped up, sometimes on days or a couple of weeks' notice with respect to testing, where we increased our capacity for testing to 21,000 PCR tests a day. The biggest vaccination program in BC's history, 1,500 people involved in contact tracing, with 6,600 people hired in long-term care to support both infection control and as part of the HCAP program. So we've seen really an unprecedented increase in the number of people working in healthcare, the largest increase certainly since public health care has been in place in British Columbia. So that's significant on the one hand. On the other hand, we're seeing a relatively high level of illness as a result of COVID-19. The impact of the Omicron variant of concern on people testing positive for COVID-19 has been significant. And that's been felt especially in healthcare because, of course, when people test positive, they stay home, and that affects numbers, such that in May of 2021, absenteeism, meaning people away sick largely due to COVID-19, but of course all the other reasons people would be sick, was higher than in 2022, I should say, May 2022 higher than 2021, which was already higher than 2020, and obviously significantly higher than in 2019. So the most recent week, which was the week before last, we'll have more numbers tomorrow, showed that about 15,000 people were away, but that number has been between 15,000 and 17,900 since about the middle of March. And though that is dramatically higher, and of course inconsistently applied throughout the system. And the places that are most vulnerable to that are places such as Clearwater, which have a small number of workers, and on a weekend a very small number of patients visiting them, where in order to maintain safety, 1 or 2 people being away can affect the emergency room there being open, and that's what we're seeing in that community. But it's affecting everyone in healthcare, I'd argue, because it affects obviously the people who are sick, but also the people that have to come in. So that's occurring. And finally, we're doing a lot more. I mean, there's always a lot of discussion of primary care, but I just note that there were 1.5 million more paid visits in 2021-22 than there was in 2019-20 before the pandemic. In other words, we went from basically 18 million to 19,500,000 paid visit. That is expanding well above the rate of population growth, the number of primary care visits that are paid and that are being provided by doctors through the system. In addition to that, we're doing more surgeries than we've ever done before, more diagnostics by a mile, or a kilometer, I guess, than we've ever done before. And we see a lot of people, in addition to COVID-19 and the overdose emergency, a lot of people now returning to the healthcare system in significant numbers for things such as testing. So I think all of those things are happening once the output of the healthcare system is beyond anything we've ever seen before, but so is the demand, and you're seeing some of that challenge everywhere in BC.
Sachin, CTV.
Just on the heat response plan, as you know, the coroner's report came out and said it disproportionately impacted people with disabilities and seniors. So some of the advice that we've heard before, and we heard from you now, includes things like, to take a cold shower, to get to a cooling center, which may be difficult for people who have mobility issues. So I'm wondering, what does the heat response plan plan to do for people who may be in that situation, who may have mobility issues? Maybe they don't have a large social network and can't get people to check on them. What's the plan for them?
Well, there are a number of things. First off, we are awaiting the outcome of the coroner's report, which will be coming out in terms of the heat dome, and I fully expect that that will have other recommendations as well, which we will be able to act on. Part of the work that's undergone is to be working closely with local governments and local communities, being able to assist, for example, in some of the funding that's been announced, so they're able to do some mapping and get a better understanding of where people are likely to be. So we saw that in many cases it was in older apartment buildings that did not have air conditioning, for example. So the ability to work with local governments to identify those places, and then you can target specific messaging and supports to those areas. At the same time, the alerts will also be out in 2 stages. So there will be the alert, which will go out as we come into a period of 2 days where we're going to be in the specific regions of the province, the temperatures that will trigger a broadcast intrusive alert, and then there will be the alert itself. So there will be much more notification, much more in the media, if you like, and also much more communication with local governments that will assist us in recognizing that people with disability and mobility issues, they have challenges. And as I said, we're also waiting the outcome of the coroner's report.
And so just on that communication piece, so is there a plan also here to work with municipalities, local governments, to get to people who may not hear the alerts and who may be at the highest risk in some of those low-rise apartments? And what is that plan specifically?
So the broadcast intrusive alert is one tool in the toolbox. There are a range of other tools that would be accessed. So obviously the broadcast intrusive alert is one. Media is another. Door-to-door is another. All of those things combined can be the cornerstones and the key elements of a plan to reach people who may have challenges in terms of mobility or disability, for example.
For the next question, we'll go to the phones. Our first question from the phones, Lisa Usda, City News 1130.
Hi there, ministers. I'm wondering why this now, when you made the announcement a few months ago about Alert Ready. This was not believed to be able to be a part of it, but it is now. So what has changed?
At the time, I did not say that it was not going to be ready. What I indicated was that there was some additional work being done with the Ministry of Health, because this is more than just alerting people. This is also a health issue. So there's some additional policy issues being done. At the time, I said we would be doing it, and now is the appropriate time, as I said I think in some well over a month ago, that it would be ready at the beginning of June, and now is the time of June, and we are launching it. At the same time, we've also made it clear that we will be able to have the broadcast intrusive alert in place for the fire season and the freshet season.
And I'm wondering, and I don't know if I missed this, so I apologize, but what is, you just mentioned, or one of you ministers did, about the temperature that will trigger this. What is the temperature? How will that be set?
That will vary from different parts of the province. So, for example, in the Lower Mainland, it will be 2 days of a temperature of 29 degrees Celsius, anticipated temperature, daytime high, and then a nighttime low of 17 degrees Celsius. In the Eastern Fraser Valley, it will be 32 degrees Celsius, a daytime temperature, and 18 degrees Celsius for a nighttime temperature. And in the interior, so for the Okanagan, for example, you're looking at daytime temperatures of around 35 degrees and a nighttime temperature of 19 degrees. And in the north, it's a temperature of about 29 degrees and a nighttime temperature of 17.
Question from the phones comes from Andrea Wu, Globe and Mail.
Hello. Last year showed that people living with schizophrenia and substance use disorders are at much higher risk of dying during extreme heat events. I'm wondering, aside from the new alerting system, have there been any specific efforts to reach these groups specifically?
Well, first, we have been working on the development of the broadcast intrusive alert. At the same time, also working in terms of EMBC on the communications and working with local governments so that we're able to identify, for example, places for cooling centres, funding in place that local governments can apply for, that in part of this budget that will allow, for example, to do mapping of where vulnerable populations are and vulnerable areas might well be. Also working very closely with First Nations so that we are able to use all the tools that we have available to us to make the broadcast intrusive heat alert as effective as possible.
Andrea, do you have a follow-up?
I do. After last summer, there had been some talk that the BC government, through BC Housing, would either provide or fund cooling devices to housing providers for common areas and potentially individual tenants. Is this happening?
So right now, we've announcing today the broadcast intrusive alert. We're also we have announced the funding that's away for community emergency preparedness, which will include the ability to access funds for, as I said, for mapping, the transportation to cooling centres, identification of where cooling centres should be located. At the same time, we're also awaiting the coroner's report into the heat dome, and I'm sure that that will contain additional recommendations that we will be looking to implement.
Next question comes from Denise Ryan, Vancouver Sun.
I guess this is similar to Andrea's question. I'm wanting to know what larger policy changes beyond alerts, messaging, and support are being put in place to address the needs of the elderly, the disadvantaged, especially those who live in BC housing units or older apartments that have no central cooling, who may not be able to contact building managers after hours and on weekends to ask for cooling units, who may not have access to cooling centers, or may not be able to leave their homes. If heating is required in the winter, why is cooling not required? And if this is an emergency, potentially emergency situation that we're moving into, what interim measures will be put in place to provide those cooling units before larger policy changes can be made?
So today we're announcing the broadcast intrusive alert, which, as I've said, is a significant new tool in the toolbox. At the same time, we've been working with the Centre for Disease Control, the Ministry of Health, BC Housing, the BC Heat Committee, that will look at other measures, for example. So within BC Housing, obviously it's identifying tenants who may have may be vulnerable or have disabilities that require attention in terms of a heat warning. So as I said, the heat warning will take two components. First, the heat alert, which indicates that we are moving to where there is a need for a potential need for an extreme heat warning. At the same time, that will allow not just BC Housing, but communities to be able to plan for what is coming. So it's not something that's coming on suddenly, so that they will be able to identify residents in their buildings who may be at risk or who may need assistance or who need to be checked on, or specific cooling is required, identifying cooling stations either in a facility or close to a facility, providing transportation, so to take those who are vulnerable to a cooling station if it's required. And as I've also said, I'm sure that I know that there will be additional recommendations coming from the coroner's report that we'll be acting on.
Denise, do you have a follow-up?
When will those recommendations be coming, and will they be coming in time to put active policies in place before the summer?
I expect so. The coroner's report is coming soon, is my understanding, and very soon.
All right, the next question comes from Moira Whiten, the Tyee.
Hi, thank you. During the second and third waves of COVID, we had direct COVID relief benefits for those most affected, and knowing that the heat wave specifically affected people with low income and who are on provincial disability benefits, has there been any thought of a direct relief payment or other program to provide the funding necessary to buy an air conditioner or other preparedness for heat wave?
At this point, the focus has been very much on being able to alert people to the dangers around heat, to ensuring that we've got an alert system that will be able to warn people ahead of time that we are moving into a period of extreme heat that may require additional measures that can be taken either by local communities or by the province, and that's where the focus of the work has been at this point.
Moira, do you have a follow-up?
I do. We also saw that older long-term care facilities and other congregate living and group home settings were particularly affected by the heat dome last year. What exactly has been done specifically since the heat dome, and what, if nothing has been, why wait until the coroner's recommendations to take action?
Well, significantly, action has been taken in congregate settings, most notably in long-term care, where very significant federal and provincial investment has taken place in infrastructure to provide both temporary solutions and temporary things, so areas of care homes that are safe, and also to put in place cooling systems. And those were very significant investments that have been made in the long-term care system. Obviously, in many places in congregate living, we're looking at and have been putting in place, and you'll see that in our efforts to upgrade long-term care homes, for example. There are other examples in long-term care. You see significant need to both replace and to upgrade into the 21st century many of those facilities. But that said, a significant investment has already been made in congregate living circumstances, in particular in long-term care, and it's part of our partnership with the federal government.
Next question comes from Stephen Labbe, Glacier Media.
Hi, thanks for taking my question. First one, I'm curious, who will make the decision to send a broadcast intrusive alert to specific communities?
It will be the BC Heat Committee. So in terms of a broadcast alert for, let's say, for example, a flood, that decision is taken at that local level. In the case of the heat alert, it will be taken by the BC Heat Committee.
Do you have a follow-up, Stephen?
Yeah, so You know, we've heard some questions around, you know, people who are particularly vulnerable. I'm curious, though, how do you get the message to seniors, to outdoor workers who might not get the message because they don't speak English or don't trust the government because of their immigration status, for example?
We've got a number of the documents done in advice in terms of how to deal with heat, and the alerts will be, can be, or will be in a multiplicity of languages. So that's underway. At the same time, this is still very much a tool for the toolbox. This is not the silver bullet by itself. So there will still be other methods of communication which will be important, both in terms of the media, both mainstream media and ethnic media, as well as door-to-door and through employers, for example, and particularly those who are out in the in remote areas. At the same time, WorkSafe is also involved in has been involved in the assisting of the requirements that we're putting in place for the heat alert and the heat warnings, or the extreme heat warning. So all of those things together will allow us to reach the maximum number of people.
Next question, Sarishti Gangdev, Burnaby Beacon.
Hi, thank you for taking my question. There's been a couple of questions already on this front, but I'm not sure that I actually heard the answer there. So just to confirm, if the coroner's report comes back with a recommendation that the provincial government provide air conditioners to people, or cooling devices to people with disabilities, people who live in SROs, other vulnerable people, will the province be providing those devices?
That's why we are waiting the coroner's report to see what the recommendations have to say. Then obviously we examine the recommendations, but obviously this is a critical issue, and that's why we are taking the proactive action that we have been taking.
Follow-up, Sarishti?
Yes, please. Last year during the heat dome, there wasn't a lot of relief overnight, with those nighttime temperatures still being pretty unbearable. Is the province doing any sort of work in kind of finding solutions for people overnight if that kind of event happens again?
Very much so. I mean, last year's heat dome was absolutely unprecedented. We had never seen anything like that in this province. And one of the important things is obviously to learn the lessons from that. And so that's why this announcement is today, in terms of our ability to be to have an alert system that not only takes into account that we are approaching a potential heat emergency by having the two-stage alert. So you've got the heat alert and then the extreme heat emergency. So those things are in place, but also working a lot more with local governments in terms of the identification of cooling centres, cooling stations. The province made it clear that we would be paying for the transportation to get people to cooling stations. Again, funding in place that will allow local governments being able to access to do mapping in terms of where the most vulnerable populations are, and so being able to be better prepared in terms of the provision of cooling stations, putting out information in numerous languages so that people have access for those whose English is not their first language, in terms of what services are available, what to do as we approach a heat emergency, how to stay cool. All of those things are in place. And as I said, I fully expect with the coroner's report there will be additional recommendations.
We have one more question from the phone lines before we come back to the room. We'll go to Alexandre Lepoutre, Radio-Canada.
Thanks for having my question. It's a question in French for Mr. Dix. Monsieur Dix, comment on va être mieux préparé cette année par rapport à l'an passé?
Alexandre, est-ce que vous pouvez prononcer? Can you go a little bit louder, please?
Oui, excusez-moi. Monsieur Dix, comment va-t-on être mieux préparé que l'année dernière?
Eh bien, là, il y a plusieurs réponses à cela. Premièrement, on a beaucoup augmenté les effectifs de BC Emergency Health Services et on a établi un plan pour eux, pour répondre à un tel épisode, si ça reviendra cette année. Deuxièmement, on a mis en place le BC Heat Alert and Response System, BC HARS, qui va donner des renseignements immédiats aux gens un peu partout dans la province dès que les températures et le temps met des tests importants. Donc, ces deux systèmes dont on parle aujourd'hui demandent une capacité de répondre. Aussi, on a établi déjà un fonds pour le Community Emergency Preparedness Fund de 189 millions de dollars qui répondent à de telles questions aussi. Nous avons eu des épreuves depuis un an. L'épreuve de COVID-19, la pandémie continue. L'épreuve des temps un peu partout dans la province qu'on a vu et des incendies un peu partout dans la province, etc. Donc, on a eu des tests et il va falloir répondre surtout des tests qui viennent du changement du climat qui existe dans notre planète actuellement et qui va devenir de pire en pire dans les années à venir. Donc, ces réponses qu'on annonce aujourd'hui sont une réponse à cela, pas la seule réponse, parce qu'on va avoir d'autres choses à faire et à dire, mais une réponse importante tout de même.
Do you have a follow-up, Alexandre?
Oui, simplement sur le nombre de personnel. Vous dites que vous allez renforcer le ambulance system. Vous allez mettre plus de personnel, c'est ça? Augmenter les effectifs?
Oui, plus de personnes dans tous les métiers du système. Premièrement, on a augmenté, bien entendu, le budget des services à peu près 32% dans 3 ans, ce qui est important. Troisièmement, plus d'ambulances et plus de gens qui travaillent à plein temps un peu partout dans la province, dans 24 communautés de la province. Donc, une grande augmentation des effectifs dans des villes urbaines, mais aussi un investissement sans précédent dans nos systèmes ruraux. Et je pense que ça va faire une différence importante pour la réponse à un tel incident, mais plus important peut-être, ou aussi important, je veux dire, améliorer les services quotidiennement.
Now we come back to the room. We'll go to Richard Zussman, Global News.
Minister Farnworth, are there any requirements in here for municipalities to act? So if an emergency is declared, must the municipality put in these cooling stations or overnight cooling sheltering? Like, are there any requirements here that would trigger a municipality to have to do something?
So obviously when a heat alert is put out, and it's a 2-stage process, and then it goes to the heat emergency. Local governments will be putting in cooling stations. We found no reluctance on the part of local governments to put in cooling stations. We've indicated that there's funding, such as we had last time, to be able to operate them, to be able to move people to them, the transportation. That's why we've also provided the money through the Community Emergency Preparedness Fund, so local governments can do the planning that needs to take place in terms of the best place to locate a cooling station, better understanding the location of where vulnerable populations might be.
And for Minister Dix, last June and July during the heat wave, the ambulance system was completely decimated in places. People were waiting hours and hours and hours. I know you've made changes since then. Do you have confidence that if we are to experience another event like last summer, that there will be enough ambulances for everyone who needs one?
Well, 2 things happened. First of all, our ambulance paramedics responded to and helped more people than in any other days in the history of the ambulance service. Just the level of demand was so far beyond what they were able to meet, that there was a significant impact that we saw. And so how did we respond? One, made changes in the administration of the ambulance system, had Chief Ambulance Officer put in place, Leanne Heppel, a new board for the BC Emergency Health Services led by Jim Chu, a distinguished British Columbian. Very significant increases in staff and ambulances, not just in urban areas, but in urban and rural areas. And more fundamentally, the change that needed to be made, perhaps for decades, but is being made now, which is moving from an ambulance system which was largely made up of staff that wasn't full or part-time staff, permanent staff. But we moved from essentially 33% permanent staff to 56% permanent staff, and that has to increase. In other words, we had a temporary on-call ambulance system in 2017. We've been moving in that direction. We've got to continue to move in that direction in order to be able to recruit the ambulance paramedics of the future and add the services we need. So yes, we're better prepared than we were. In addition, we've put in place improvements. We've learned some of the lessons of what happened last year in terms of improvements about how we move staff around in cases of emergency. So I think the BC Emergency Health Services is better prepared than they were a year ago.
Next question, Rob Buffum, CTV, Vancouver Island.
Minister Farnworth, I just wanted to clarify, so these alerts that will be issued based on the temperatures set out here, as a practical matter, that'll be an alert that goes to people's phone by way of text as well as things over the radio and broadcast on their TV? Is that what we're talking about?
Yes.
Okay. And then in terms of, you set out the thresholds in this release, including for the Southwest region, I assume, but I want to confirm, that applies to all of Vancouver Island?
Yes, it does.
All right. Thanks.
And our last question today comes from Shannon Waters, BC Today.
I wanted to ask about the timeline for the coroner's report and acting on those recommendations. Your government has received previous reports with recommendations from the coroner. Some of those are still looking for action 4 years later. So are you committed to acting immediately on all of the recommendations made by the coroner?
We await the coroner's report, and we will review the recommendations. But obviously, you know, the fact that we're doing this announcement today is and following up on the commitment we made that we would be having an alert system in place for the heat dome season, I think is an indication that this issue is taken by government very seriously.
And in terms of the alerts, can you tell us a bit about the timeline when it comes to the alerts that are currently being sent out? Sometimes it's like there's not a lot of time necessarily for people to react aside from, say, an evacuation. So in terms of preparing and having time to prepare for extreme heat, do you have an idea of how much time people can expect?
That's why we've got a two-stage process in place. Obviously, we're watching the temperature and the weather over, right now for the freshet, we're watching the weather and the predictions that Environment Canada puts out. So, for example, we know it's being cool for the next number of weeks and that they're not seeing any extreme heat on the horizon. So obviously it's watching the weather. That's why it's developed into a two-stage alerting process. So as we see the temperature moving towards those thresholds, there is the alert that is put out. That sends a message to local government. It sends a message to you in the media that, look, we are approaching this and that we need to start to think about being prepared. The heat emergency is when those threshold temperatures are reached. So it's not kind of a sudden thing. It's an incremental, we're getting close to it, and then here's when the alerts are going out and the temperature thresholds are there for people to see.
Thank you very much. That concludes today's event.